Hello, everyone. This is Dr. Aclan and Dr. Davila here presenting the Designing BIPs or Behavior Intervention Plans to you all. Some of you have had some previous training in BIPs, but it's always a good thing to brush up on those skill sets, especially since that's a big part of what we do with our clients. Obviously, when we start off with behavior intervention plans, we always have to start off from what does the behavior look like and what's the function of the behavior. You know, as a behavior analyst, we're always asking why. So when we see a behavior, first we have to see what does it look like, right? We want to make sure that our operational definitions are clear, that it's nothing left to question, that if someone walking down the street is going to either demonstrate the behavior or if they see the behavior, they could describe the same thing as you. We want to make sure that it's objective, so there's no room for interpretation or assumptions. We also want to make sure that we're addressing the function of behavior. So there's various pieces of an FBA, and you know, we have multiple things that we can do. So here we have different tools that can be used. We have the functional assessment interview, or FAI, that gets the background information, the history, the duration, when the behavior is likely to occur. We have the QABF, which is the questionnaire that is asked to caregivers as well as our BTs, to ask them what they see and how the function of behavior can be hypothesized. Obviously, interviews are only part of it. It's only an indirect assessment. So direct observation is very important. So collecting ABC data, whether it's narrative ABC data, where we're collecting all the points of the behavior, or structured ABC data, where we have specified antecedents and consequences and possible locations that we're just marking when and where and how the behavior occurs. We could run a functional analysis, or FA, where we, in a controlled setting, test the conditions and manipulate each one of the functions to identify what the function or functions of the behavior are. And then also too, in our FBA, we're also identifying a proper data collection system, whether or not a certain behavior we take on rate or frequency, whether or not we have to take a duration data or a sample count. So in the beginning, we always have to kind of assess and gather all this information before we move forward.
Good morning, everyone. This is Dr. Davila. Thank you, Dr. Aclan, for that introduction there and for the first topic. So definitely, like Dr. Aclan was talking about, the whole process of data collection and selecting your data collection system. That's going to be so essential. From the beginning, especially when you're doing your baseline phase, you want to ensure that you have a really proper data collection system set up. And also that's going to go in tune with your treatment phase. So you're always going to be doing some type of data collection. So one of the things we always talk about in grad programs, we always talk about in our field, is we need to always have our analytical hats on, because we want to analyze to see if our clients are making progress or no progress. And obviously, we always talk about it's all about data for us, and that's absolutely true. As a supervisor, you need to consistently be evaluating your data on a daily, if possible. Now that we have some of the platforms like Catalyst, you can see data, pretty quickly. And for sure, that's is really critical for you to consistently be looking at data. And if you see no progress or variability within your data collection, your graphs, have this really funky look, it's all over the place, then you want to take a step back and always want to, go back to the basics. Ask yourself, is it because, my staff is not doing the data collection, properly? And a good way to confirm that is through your inter-observer agreement, the IOA data that we have in our infield forms. The same thing with looking at treatment integrity. Is it that because my behavior technician or a parent is now drifting away from the plan, The only way to confirm that, once again, it's by tracking data, looking at the BIP, checking off which steps are being properly implemented and which ones are not. And lastly, you want to also look at whether the treatment is appropriate for the setting and environment. So, for example, if you're trying to implement a plan ignoring program or intervention in an apartment, right? The family lives in the second floor, and the child is screaming and throwing items all over the place, and the neighbors downstairs are complaining about that. Then family is more than likely not going to continue implementing that because there's other contingencies there. So you want to try to look at the entire scope. You want to really analyze and really think about critically what it is that's realistic for the family across all types of settings.
Exactly. And along with that, of course, not just developing interventions based on really what we see, we also have to go back to our behavioral principles. So looking at research journals, looking at previous interventions that have been successful for similar functions or topographies of behavior, looking at common interventions for antecedents, and even how do you even fade out schedules of reinforcement or prompting strategies. So along with collecting data and assessing, we also have to do some sort of lit review. We have to look at what what is out there. So we all have access to Java and behavior interventions, especially if you're tied to the BACB website. They do give their members access to journals for us to look at. You could also reach out to your colleagues, to other CMs, to your supervisors, to your BCBA supervisors, even to your CDs, to see if they have any resources. With the great thing with technology, we have a lot of videos of different interventions and also tutorials that are accessible to us. So whenever we're looking at how am I going to intervene, how am I going to be able to modify this behavior, you do have resources. The only thing to look at is to make sure that, again, it's all within the realm of ABA, everything's evidence-based, and that it's from a credible source. If you have any questions on those credibilities, always reach out to your BCBA supervisor or directors or even Dr. D or myself. You also have the Cooper textbook or even other ABA books. Like there's even the functional analysis book that Greg Hanley has. There's the behavior interventions book that Michelle Wallace has. So there's various resources out there. And if any of your colleagues have them, obviously we could always share those resources.
Dr. Aclan, I like how we gave it its own life too. Cooper Booker, it's like its own, it's so relevant to us in the field that we had to name it our own, give it its own name.
That's one thing that ends up happening, a typo or two, a couple passes.
That's awesome.
Which is why it's always good to have IOA and treatment integrity in place.
Okay, is this mine, Dr. Aclan? This
Yes.
slide right here? Okay, perfect. So one of the things for sure that we need to do, team, is you need to consult with your BCBA. Your BCBA, one of their primary jobs is to be there as a reference, as a source for you. If you're not really sure about your definitions, you're not sure about functions, you're not sure about your BIP, whatever systems or process you're going through, you're not sure about, you need to always consult with them. You need to ensure that you have that communication, that relationship is there, that rapport is there for you to be able to feel comfortable to go to the BCBA. And even sometimes, even within our own team, if you're already a BCBA, just feel comfortable to know that you can go to other BCBAs, other people. We all have our own experiences. We all have our own, repertoires, and I think one of the most, humbling and one of the cool things about working in this field, that you have people that have different strengths, right? And and areas of interest. And I think when we work together, that's when we have a really strong and powerful way of navigating and helping more clients. All right. So the next thing to consider is you want to think about the process and have a game plan. I always mention when you talk to me, I always talk about game plan. I love sports. It's one of the things I enjoy is watching basketball, watching different sports, soccer. And I think that when you think about the whole process of how do you prepare for a game, how do you prepare for anything, it's a preparation. That process is so crucial. Like Dr. Aclan talked about the research, the videos, you become very studious. You become really, really involved in that process. And it just comes down to picking, a few treatments and interventions, and then going through that probing phase, which is something that Dr. Aclan is going to talk about. But for sure, one of the most important things here is that we always preach and we always try to for sure encourage people not to be a bag of tricks. We always use that because we want people to go away from using same strategies across their clients, because that sometimes can lead to very poor outcome for clients. So the best way to do this is by reviewing each client's profile, taking the time to do the research, read, study, evaluate. This process is not easy. This profession is not easy, but it also is very, very rewarding. It's part of the process that I find really rewarding is always trying to find ways how you can create a individualized plan for your clients. Lastly is consult with your BCBA before starting anything. Ethically, it's very necessary for you to ensure that you have the proper training, the proper level of competence to implement anything that you're not sure about. So highly encourage for you to always keep your BCBA in the loop about any intervention, anything that you're going to do with your clients, because it's their responsibility. They're the ones that sign that report. So it's up to them to also know where you're at in regards to your interventions. Okay, so I know Dr. Aclan, this was I'm gonna do this one right here because this right here I told Dr. Aclan I had to pick this picture here, the laboratory, because what it is that when you're working in the field, when you're probing these strategies, you're basically it's a lab. You're testing things out, and you're trying to see which is the one intervention or interventions that work, for that particular client. So the logic will tell you that the more time you spend working with the clients, the more probably you're going to have of finding out that proper mix of interventions, or that proper treatment that's going to be required to support the clients. So one thing for sure I have to emphasize is that you will make errors in the process. So don't be afraid to make mistakes. If you're afraid to make mistakes, you're never going to be better. You're not going to learn. So don't be afraid to make those errors. It is part of your own development. And it's also really important for you to make the mistakes and not for your BT or parent to make the mistakes, because if they're the ones that are getting all these errors, all these mistakes, they're going to have a more difficult time to truly buy in or really follow the long-term concept of behavior analytic principles and everything that we do. It's going to be a lot harder for you to be able to get them to buy into that. Track your data. That they're so critical for you to make that those decisions. You want to document also what kind of response the client had to your intervention, so you can be able to once again filter out any interventions that are not necessary. In our field, we have component analysis. So component analysis is a form of evaluating different types of treatments. So we want to find out what's necessary and what's sufficient. Sometimes some of your interventions are not really needed, but you put them in there because they work for another client. But here you would truly want to narrow down the interventions that are going to be necessary, so you can be able to save yourselves extra time and even extra tools or materials that are maybe required for another intervention.
So with that said, once you are able to probe and your formula is successful, you want to put it to action. We just like a scientist, we have our own language that we speak. We have our training, we have our principles to back it. However, our parents don't always have that same level of training or understanding. So when we put things to action, we actually have to translate it to something that our parents as well as our BTs are really going to understand, and how they're going to be able to implement this plan without your presence. So a couple pieces to look at are, first, make the steps simple. You want to make it such that they could just take a look at it, at the plan, and just run with it. Think about it as like a recipe or instructions to build something. You don't want to make things so overcomplicated that it becomes very aversive to even follow it. You want to make sure the steps are readable. You want to make sure that if you are creating a complex plan, how can you break down the steps so that the individual could follow them? Also, too, you want to make it appealing if you need, if necessary. So add colors, add designs, put examples and non-examples into it. Here's just an example of a parent-friendly version of a BIP. Obviously, this is not the exact plan that we put into a progress report. However, it's a plan that we can have in our Catalyst books for our BT. It's also something that we could print and give to families so that they could review, put that on their refrigerator, just carry with them. It's just going to be a way that, one, it's going to be more motivating to use because it's not as daunting as a multi-step BIP that is very complicated. It's also something that is very clear as to what we're doing. So what is the behavior that we're looking at? What's the function? So why is it happening? What's the alternative behavior? What are the antecedents and consequence strategies? How are we going to reinforce? And how are we going to collect data?
All right, this is mine, Dr. Aclan?
Yes, it is.
Perfect. All right, cool. So the training phase is obviously very essential. We've gone through the process of identifying functions. We've gone through the process of doing our research. We've gone through the process of writing down the behavior intervention plan, breaking it down as much as we can. Now we get into the process of training, okay? And this is absolutely so essential. And I think that, working at ICAN-B, one thing you're going to, forever and ever hopefully take with you is BST model. We preach and teach the BST model because it's so critical for you to use this, okay? The instructions, modeling, the role play, and feedback, these are really important components to train BTs and parents, okay? So the BST model will be very important for your training phase. Now, we start off with the whole aspect that you want to initiate the training with the behavior technician, okay? That's going to be your first, the first person you're going to be working with, okay? So ensure that the BT can implement the strategies. We put 80%. I mean, it can be higher than that, or at 80% or above the in treatment integrity, and take data as the BT implements. One of the things that you notice too as well working at ICAN-B is we do infields. And the infield checks and the data collection allows us to document how well a behavior technician is implementing a behavior plan. So continue doing that, provide feedback, and continue documenting if a behavior technician is not implementing something, give them feedback, let them know, hey, look, it's very essential for us to get back on track with this because our client is going to benefit from that. Once your behavior technician has met criteria, then you can start training parents to implement strategies. And once again, we put criteria at 80% or above in treatment integrity. And like any, systematic, way of doing behavior analysis, we put criteria and objectives and benchmarks so that you can always see if you're making progress and you're getting closer and closer to that, objective of being able to transition the client out to maybe another program. So that's more or less for training phase. Like Dr. Aclan said, if you're not sure about the training or if you're not sure about some of these BST model components, please consult with your BCBA. They're there to support you. And also you can reach out to Dr. Aclan and myself at any time.
Exactly. And, after we train, we don't just end there. You have the evaluation phase. So each time you're with your client, You want to review the data. You want to see if you need to modify anything in your intervention. You might even have to evaluate your data collection procedure. Remember, even if the behavior looks like it's reducing, if parents or BT are saying that, well, it looks different now, or even though the data show a certain way, is it something in terms of the training, or does the behavior, is it duration that you have to look at now instead of some sort of rate or frequency? So you need to review and see if you need to make any modifications each time you're out there. Rule of thumb is about once a week. You need to modify, or even a month, and that might not just be modifying operational definitions or even data collection methods. It could even be schedules of reinforcement. So instead of reinforcing each instance of the desired behavior, maybe you have to thin it out such that it's more in a naturalistic way. Do you have to fade out your prompts, or do you have to modify your prompts, go from less intrusive to more intrusive, or from more intrusive to less intrusive? We also want to make sure that we're testing for generalization. With generalization, we always want to program it from the start. We don't want to wait towards the end to program for generalization, because we want to ensure that the client is going to be successful from the beginning. Another thing is that if the data are on a decreasing trend and meet the requirements of 0.2, then, and they also, don't have any errors in terms of the way the data are collected, then you could start fading out the BIP. And we'll talk about fading BIP right now in the sense of some helpful tips. We might have to constantly evolve with the behavior and the function and topographies and all of that. But also, we are looking at maintenance. So one misconception of a BIP is once the behavior decreases, then we put it to rest and we don't have to review it anymore. No, a BIP is there forever. It's just in a matter of how much attention we put. We might have to, come back to it every now and then, because we might see some sort of resurgence or spontaneous recovery going on. We also want to monitor if the topography of the behavior changes over time. So when it comes to behavior intervention, it's never an ending process, which is why we want the families involved, because when we're not there, the families are going to be there to implement and monitor the behavior as well. So this is our presentation on BIPs. If you have any questions, we are going to allow time now for the CDs to have a discussion with the group. And if there are any other questions above this conversation, feel free to reach out to Dr. D or myself. Thank you all for your time, and we will chat with you next time.
Thank you, guys.